Good evening. Am I audible and visible? Yeah. So, if you're joining my session for the first time, this is Dr. Shanmugapriya, your PrepLadder faculty for biochemistry. And today it's a biochemistry recall session of the latest NEET PG 2023. And let me start the session with a disclaimer. So the questions that will be discussed in this PowerPoint are purely recall based, and the motto of this live session to get the actual MCQ. And after all the questions are collected, after discussion, the same will be uploaded on the PrepLadder app. So this is the disclaimer. And before we start the session, hi Gaurav. So before we start the session, can I know from you all how the paper was and what is your experience and how do you feel after writing this exam? I would like the live chat to be active. Hi Madhu. How was the paper? How did you write? How was biochemistry? How was the paper generally? Yeah, can I know from you all through the live chat? Hi Ravi. Hi Shailendra. So if you ask me to review the paper was moderate, is it Gaurav? Yeah, even I feel so. So if you ask me to review the paper, because I was seeing questions from all subjects. So my understanding of the paper is topic coverage wise, it was generally the popular topics that were covered. Yeah, not much of new topics that were asked about in this paper. So topic wise, it's the usual expected topic. But if you ask me about how the concepts based on which MCQs were asked, they were a bit different. For example, in biochemistry, glycogen storage disorder, is a popular topic, and there was a question, not one question, there were two questions on glycogen storage disorders. And I would say both these questions were based on a different concept. For example, till now I've never seen an MCQ based on glycogen synthase defect, and this time there was a question on glycogen synthase defect. They had mentioned in MCQ that glycogen content of the liver was nil. Okay, so that is the difference as far as this paper is concerned. So if you ask me for every subject, there were few MCQs which have high discrimination ability. Okay, so all came from my notes. I'm very happy, Madhu. Yes, most of the questions, almost all the questions we had already discussed. Yeah. Hi, Mohammed. Hello, all of you. Yeah. So that is my understanding of the paper. And about biochemistry, I have 16 MCQs. I've collected 16 MCQs for all of you, from all of you. And most of these MCQs are based on vitamins as expected. So whenever students used to ask me what is a topic that I should definitely cover before my exam, I would say vitamins. Reason is, if you learn vitamins, it means you have learned almost all metabolic pathways, and every vitamin will have relevance in a metabolic pathway. So only when you have understood the metabolic pathways, you'll be able to answer an MCQ based on vitamins. Most of the questions were based on vitamins, and there were questions on inborn errors of metabolism. Good evening, Irshad. And there were questions on inborn errors of metabolism. And other than these two topics, I hardly saw any MCQ in biochemistry. Yeah, both these are expected topics. Okay, so with that basic review on the question paper, thank you, Pragun. Is almost every MCQ we had already discussed. Particularly during the last minute revision, yeah, I had discussed almost all the topics. Yeah, so good evening, Med Psycho. Good evening, Manoj. Yeah, so this is the first question that I'm going to discuss about today. And this will be a quick discussion because I know you're all anxious to know the answer, right? Rather than the explanation, I know you're all ready to listen to the answer first, and then I'll give you a bit of explanation, okay? So child presented, good evening all of you. Good evening, Karthik. The child presented with difficulty in vision, biochem prepper cup update hogi ma'am. It will be updated the next month. It will be soon update. Okay, yeah, most of you are giving me the right answer. Pragun says it's Niemann Pick. Kennel says it's Choicey. Okay, let me first let you lose that anxiety. The answer is Tay-Sachs disease. Okay, answer is Tay-Sachs disease. Why am I excluding Niemann Pick? Because Niemann Pick presents with organomegaly. So they had given you 3 clues here. Very good, all of you. They have given you 3 clues. Difficulty in vision means there is neurological manifestation. There is a child presenting with neurological manifestation with cherry red spot, but there was no organomegaly. These are the 3 clues which were given. Just because there is cherry red spot, you can exclude few disorders because I've given you a mnemonic for it, haven't I? No cherry red spot in KGF. I'm very sure all of you watched this movie Cola Goldfields, right? KGF. So no cherry red spot in KGF. K stands for Crab's disease, G stands for Gaucher's, F is for Fabry's. Based on that, what is the one choice that you can exclude? Yeah, I will give you an explanation also, Rohit, because I'm tuned that way. I cannot stop myself from explaining. I will do that, but I'll give you the answer first, okay? So no cherry red spot in KGF, so Gaucher's disease can be straight away excluded. Similarly, I can exclude Hunter's disease also. Am I right? Because Hunter's disease, you know, vision has to be proper. Yeah, I told you even corneal clouding is not a feature of Hunter. And Hunter has got no relevance in cherry red spot. So this is not Hunter's disease. Now between Tay-Sachs and Niemann-Pick, I'm going to exclude Niemann-Pick because Niemann-Pick is known for its organomegaly feature. Okay, so what is the right answer, all of you? The right answer is Tay-Sachs. And this I told you so many times. Organomegaly and systemic manifestations are features of GM1 gangliosidosis. Yeah, what have I told you? Organomegaly and systemic manifestations are features of GM1 gangliosidosis, whereas GM2 gangliosidosis present only with neurological manifestations, no organomegaly. So be it Tay-Sachs or Sandoff, they don't present with organomegaly. So what is the right answer? Yeah, from first year. Yes, you can watch this. This will give you an understanding of how questions are asked. Yeah, and I'll also be giving you an explanation, Aisha. I'm happy that you're interested so much that you're watching this already. So what is the right answer? The right answer here is Tay-Sachs disease, okay? Because there is no organomegaly. Next question, a child presents with diarrhea, dermatitis and dementia. If you ask me which is the most frequently asked MCQ ever, I would say this, yeah? 3 Ds, diarrhea, dermatitis and dementia, 3 Ds of pellagra caused by vitamin B3 deficiency or niacin deficiency. Okay, I see some of you to answer it as B6. It is not B6, Zebi. I don't know how you pronounce it. Yeah, what is the right answer? It is niacin deficiency. Niacin deficiency causes pellagra and niacin is B3 deficiency. So, what is the twist here? Yeah, diarrhea and dermatitis. These are not only features of pellagra, these can also be features of acrodermatitis enteropathica. That was also asked in the same paper. So all of you please remember, just because you have gotten this registered in your memory, yeah, you know that we always say diarrhea and dermatitis means it is pellagra. But there is another condition which also presents with diarrhea and dermatitis, which is acrodermatitis enteropathica, which is caused by zinc malabsorption. That was also asked in the same paper. Okay, B6 was not even in the option. Okay, let's take it off. Okay, even otherwise, what is the right answer? The right answer is B3. Now the next question, a child presented with dermatitis again, thinning of hair and alopecia. The family gives history of eating raw egg whites. So that is the only clue, raw egg white. Why do you think raw egg white should not be consumed? For 2 reasons. One is there will be salmonella. Yeah, salmonella organisms cannot die if you are going to eat a raw egg. That is one reason why you are not supposed to have it. Another reason is raw white egg will have avidin. It's so cool, thank you. So raw white egg has got avidin and avidin binds to biotin. So any biotin that is present in the diet in the presence of avidin cannot be absorbed. And without biotin, all these carboxylases cannot be active. So nail growth and hair growth will get affected. That is why the child is presenting with alopecia. So the key phrase that is given here is raw egg white consumption, which has got avidin, which inhibits biotin absorption. So what is the right answer here? The right answer here is biotin. Okay. Now again, yeah, all these are popular MCQs, right? So what is this image that is shown to you here? The image has got crumpled tissue paper appearance. It was an image based MCQ with crumpled tissue paper appearance, and there is a child who is presenting with refractory anemia. So what is your right answer? What is it? Yeah. What is the right answer? It is Gaucher's disease. Tissue paper appearance. Crumpled tissue paper appearance is a feature of Gaucher's disease. And Gaucher's disease is caused by the defect of beta-glucosyl cerebrosidase. So when beta glucosyl cerebrosidase is defective, glucosyl ceramide or glucosyl cerebroside will accumulate in the membranes of RBCs and platelets. So RBC membrane and platelet membrane is abnormal. What will happen when macrophages come across something which is abnormal? Macrophages will start engulfing it, and that causes anemia, that causes thrombocytopenia. And after engulfing these abnormal membranes, glucosyl ceramides will accumulate within the cytoplasm of these macrophages like a fibril. And these fibrils on accumulation will give it a crumpled tissue paper appearance. So the moment you see crumpled tissue paper appearance, what should come into your mind? Gaucher's disease should come into your mind, caused by the defect of beta glucosidase. Okay, whereas alpha glucosidase defect. 4 images. Okay. Alpha glucosidase defect causes Pompey's disease. Yeah, please remember, beta glucosidase defect causes Gaucher's, alpha glucosidase defect causes Pompey's disease. And Pompey's, how did I ask you to remember? Pompey's, which is the pump of your body, heart. So in Pompey's disease, heart gets affected. It presents with cardiomegaly, cardiomyopathy. It does not present with anemia. Okay. Good evening, Barad. Can you save PDF of these? Yes, I will give you the PDF. Yeah, I will share the PDF with you. Okay. Now, hexosaminidase A defect is Tay-Sachs. Okay, and you don't see crumpled tissue paper appearance in Tay-Sachs. Just now I told you, Tay-Sachs is characterized by neurological manifestations. It is characterized by cherry red spot. Okay, and so this is not hexosaminidase A defect or B defect. Alpha glucosidase, another name is acid maltase. Both are same. Yeah, there was one question on liver biopsy showing 0 glycogen. I'm going to discuss about that. Both are same Mujahid Shaikh. Acid maltase is otherwise called as alpha glucosidase, which is a lysosomal enzyme, defect of which causes Pompey's disease, which is characterized by cardiomegaly, cardiomyopathy, hypotonia. Okay. Now this is another interesting MCQ, right? I found every MCQ to be interesting in one way or the other. There is always a catch in all these MCQs. So there is a history. Hi Ashish. There is a history of village people consuming a crop as a staple diet. They did not mention what crop it is, right? Many of the villagers are now presenting with paresis and are using a stick to stand. Okay, so what is it? It is most probably osteolithiarism. Right, it is most probably osteolithiarism. Very good. Answer for this question is vitamin C. So what is osteolithiarism? It is caused by the intake of, Lathyrus odoratus. It is caused by the intake of Lathyrus odoratus, and the toxin that is present here is beta aminopropionitrile. Yes, Kesar. Vitamin C. Yes, because it's a preventive measure. So the toxin that is present in Lathyrus odoratus is beta aminopropionitrile, and what it actually does is it inhibits lysyl oxidase. And without lysyl oxidase, collagen cross-linkage formation cannot happen. Collagen becomes weaker. Yeah, that is why there is bony or osteolithiarism. And you know, for collagen cross-linkage formation, what can be given? Vitamin C can be given. We know that, right? Because vitamin C is necessary as a coenzyme for prolyl hydroxylase and lysyl hydroxylase. So what is the right answer here? The right answer here is vitamin C can be prescribed for this individual. What was the question? BOVA is for neurolathyrism. BOVA is for neurolathyrism. Beta aminopropionitrile is for osteolithyrism. It is because of inhibition of cross-linkage formation. If it was on neurolathyrism, that is because BOVA is a structural analog of glutamate. Yeah, so that is why there is neurolathyrism. Based on the question, you will be able to answer it. My understanding is based on the inputs that I got from many students. The question was based on what should be given as a prophylactic measure for those who are consuming Lathyrus odoratus, in which case the answer should be vitamin C. Similar history, they asked to identify the toxin. Okay. Lathyrus odoratus is the crop that is responsible for osteolithyrism. Lathyrus sativus is the cause for neurolathyrism. Does that answer your question? Yeah, BOVA is for neurolathyrism. You're all right. Yeah, there was a question on polished rice. There is another question. I'm going to discuss about that. Okay, have I answered all your questions? A family consuming predominantly of polished rice. Ghost Rider, have I answered your question? A family consuming predominantly of polished rice would present with which of the following vitamin deficiencies? You know the answer straight away is thiamine, because thiamine is present in the allurin layer. It is present in the allurin layer of all these grains. So polishing will remove those vitamins. And that is why what we do is we parboil it. When we parboil it, the allurin layer will get fixed onto the grain, so we don't have to suffer from thiamine deficiency. So polished rice will cause thiamine deficiency. And how did I ask you to remember? The investigation is thiamine deficiency is B1 deficiency, 1 meal a day, a part of keto diet. So B1 deficiency, keto, what will you estimate? You will estimate trans ketolase activity. You will have to estimate RBC, trans ketolase activity. So what is the right answer here? Very good. Choice D, thiamine with trans ketolase. Excellent. Now this was another question. When there is low insulin glucagon ratio, which of the following enzymes is stimulated? I must have told you about this enzyme 100 times in my session, right? Minimum 100 times, because this is my favorite enzyme, hormone sensitive lipase. Just because of me, you completed biochemistry, otherwise I was going to skip subjects, and that could be my biggest mistake. I'm very happy, Meet Patel, you made my day. Thank you. I'm happy that you were able to answer many questions. So what is the right answer here? The right answer here is hormone sensitive lipase. And if you ask me how to answer such questions, you should understand what is the scenario. If they say there is low insulin glucagon ratio, it means there is low insulin and high glucagon. When will there be high glucagon? Whenever there is hypoglycemia, right? You should remember that glucagon is a hyperglycemic hormone which increases blood glucose. So that will be higher whenever there is hypoglycemia or whenever you want catabolism to happen. And I've told you hormone sensitive lipase is an enzyme which is present in adipose tissue which mediates peripheral lipolysis. So it's a catabolic enzyme. So whenever there is high glucagon, catabolic enzymes like hormone sensitive lipase will get stimulated. Whereas lipoprotein lipase, options are incorrect. Okay. What is our aim here? Our aim is to find out what is the right answer here, right? So what are the other options? If you can recollect other options, I'll be happy to change. What were the other options? Hormone sensitive lipase is a catabolic enzyme because it mediates peripheral lipolysis in adipose tissue and it gets stimulated by glucagon, which is a catabolic hormone. Okay. How about lipoprotein lipase? Lipoprotein lipase helps in extracting lipids from lipoproteins. After it is extracted from lipoproteins, these lipids will get stored. So lipoprotein lipase is like an anabolic enzyme. If it's an anabolic enzyme, it will be stimulated by insulin. Okay. Phosphofructokinase is the choice that I have given here, but irrespective of whatever the choice may be, all that you will have to find out is it an anabolic enzyme or a catabolic enzyme. If it's an anabolic enzyme, will be stimulated by insulin. If it's catabolic enzyme, will be stimulated by glucagon. If it's an enzyme which reduces blood glucose, that will be stimulated by insulin. If it's an enzyme which increases blood glucose, that will be stimulated by glucagon. That way the answer here would be hormone sensitive lipase. Okay. Yeah. Stimulation of adipose tissue, another option. If it was adipose tissue fatty acid synthesis, yeah, that is not going to happen here. Do you understand this? There will be stimulation of peripheral lipolysis in adipose tissue. HMG-CoA reductase. Thanks for giving me other choices, Pooja Patil. If it's HMG-CoA reductase, I want you to answer. HMG-CoA reductase is the rate limiting enzyme of which pathway? Rate limiting enzyme of cholesterol synthesis, which is anabolic. If it's anabolic, it's not going to be stimulated by glucagon. Okay? Yeah, next question. Which of the following micronutrient deficiencies can cause poor wound healing? Poor wound healing, yeah, it is copper. What is the right answer? The right answer is copper. Why copper? Because copper is required as a cofactor for lysyl oxidase. Don't we know that? It is necessary as a cofactor for lysyl oxidase, which is involved in collagen cross-linkage formation. And collagen cross-linkage formation is necessary for wound healing. So which of the following micronutrients is essential for poor wound healing? It is copper. Yes, I have that question also. Rash around eyes and mouth. Yeah, perioral rash. Biochemical basis of scurvy. Yeah, what is the biochemical basis of scurvy? Scurvy or vitamin C deficiency is presenting with bleeding in the gums. That is because of collagen defective formation. Because vitamin C is necessary as a coenzyme for prolyl hydroxylase. Yes, very good all of you. Yes, it is necessary as a coenzyme for vitamin C is necessary as a coenzyme for prolyl hydroxylase and lysyl hydroxylase, both of which are involved in cross-linkage formation in collagen. So for any reason when there is vitamin C deficiency or scurvy, cross-linkages of collagen cannot be formed. History was petechiae and bleeding gums. Thank you. So petechiae and bleeding gums, the biochemical basis would be impaired collagen formation, because of which the subendothelial connective tissue will become weak and that causes bleeding. Okay, yeah. A child was fatigued after exercise. So this is the question that I was telling you about. A child was fatigued after exercise, which means there is exercise intolerance. I will tell you about that question. Thanks, Sakshi. That will be the next question. Okay, so exercise intolerance, and the blood sample collected soon after exercise showed low glucose and lactate level. What is the probable diagnosis? So exercise intolerance, first you should look for which choice? McArdle's disease, right? So McArdle's disease, I've told you, Pompey's was there in the option. Okay. So I'm not going to use Pompey's disease here because Pompey's disease is going to cause death early. Yeah, death close to 2 years, before 2 years, and it presents with cardiomegaly, cardiomyopathy, presents with hypotonia, floppy baby. It does not present with exercise intolerance. A child will present with respiratory difficulties because diaphragm is a muscle and that muscle metabolism gets affected when there is Pompey's disease. Okay, so it's definitely not Pompey's disease. And this is not Cory's disease, because Cory's disease will present with hypoglycemia, which is fasting hypoglycemia. Here they have not given you fasting hypoglycemia. What have they given you? They have given you glucose level decreases following exercise. And that is why it is not Cory's disease or debranching enzyme defect. Okay. So what is the right answer here? The right answer here is McArdle's disease. And why McArdle's disease? Because it is muscle phosphorylase defect, in which case it will present as exercise intolerance particularly to anaerobic exercises. Because only when you try to perform an anaerobic exercise, you become dependent on glucose. From where will this muscle get its glucose? Muscle gets its glucose from its own glycogen through glycogenolysis, for which it needs glycogen phosphorylase. If glycogen phosphorylase is defective, the muscle will not get glucose 1-phosphate. Without glucose 1-phosphate, there is no glycolysis, so there is no lactate formation. Because there is no lactate formation, what will happen to blood lactate level? Blood lactate level decreases. And when the muscle realizes that the muscle is not able to get glucose from its own glycogen, muscle will try to extract glucose from the circulation. So soon after exercise, because the muscle somehow tries to get its glucose at least from the circulation, blood glucose level decreases. So have you explained every feature here? So M, McArdle's muscle phosphorylase defect, it will present as exercise intolerance particularly to anaerobic exercises. Soon after exercise, if you collect a blood sample, the blood glucose level and lactate level will be low, because there is no anaerobic glycolysis and no lactate. Is that clear? Severe cramp was in the history. Yeah. Severe cramp happens because when there is no ATP, when there is no glycogenolysis, there is no ATP production. ATP is not only necessary for contraction, it is also necessary for relaxation. Without ATP, there is going to be muscle cramp. Got it? Yeah. So the right answer here is McArdle's. Okay. A 4-year child presents with EC fatigability. The mother also complained that the child was more hungry between meals and the child recovers after glucose. Liver examination revealed no glycogen. Yeah. So the key that is given to you is liver examination revealed no glycogen. Otherwise, what are the two features that are given to you? One is exercise intolerance. The next one is between meals there is hypoglycemia. Yeah, exercise intolerance, between meals there is hypoglycemia. So can we start excluding choices one by one? Can it be a branching enzyme defect? It cannot be a branching enzyme defect. What is it? A, Anderson disease. So the mnemonic that I have given you is AB. Anderson's disease is caused by the defect of branching enzyme. So when branching enzyme is defective, liver will start accumulating glycogen, and abnormal glycogen is accumulated, yeah, without any branch points. Because of which liver cells enlarge, so it will present as hepatomegaly. Anderson's disease or branching enzyme defect will present as hepatomegaly and liver cirrhosis. So this is not branching enzyme defect. Now what is debranching enzyme defect? CD. Cory's disease is caused by the defect of debranching enzyme defect. And what does Cory's disease present with? Cory's disease will present with both exercise intolerance as well as hypoglycemia. But in Cory's disease, when debranching enzyme is defective, an abnormal glycogen with multiple branch points will accumulate. Limit dextrin will accumulate. And that is why it's called as limit dextrinosis. So can you answer this as Cory's disease? This is definitely not Cory's disease. Do you all understand this? Limit dextrinosis. This is not limit dextrinosis because you don't see any abnormal glycogen. It clearly stated liver biopsy reveals no glycogen, which means what should be the right answer? It should be glycogen synthase defect. Glycogen synthesis happens both in liver and in muscle. So when glycogen synthase is defective, when liver glycogen synthesis does not happen, that causes hypoglycemia. When muscle glycogen synthesis does not happen, that will cause exercise intolerance, and liver biopsy reveals no glycogen. And this is glycogen storage disorder. I changed your option from D to A. Oh. Yeah, I have told you so many times that A, Anderson, it presents as hepatomegaly, liver cirrhosis, does not present with hypoglycemia. Okay, yeah. So it is glycogen storage disorder 0. Do you all know that? Yeah, it is glycogen storage. No, it is not mandatory that the child dies in infancy. The child can, because it's all about how low the activity of glycogen synthesis is. They don't die in infancy. They present with all these manifestations. It is very rare. I would agree that. Yeah, it is a very rare condition. And why is it called as glycogen storage disorder type 0? Because in this case, glycogen is not stored. You should not call it as glycogen storage disorder. That's why it's called as glycogen storage disorder type 0, which means there is no glycogen synthesis and 0 glycogen. We don't have a name for it. It is just glycogen storage disorder 0 caused by glycogen synthase defect. Okay? Yeah, no particular name. So I heard that it was an image based question with bow legs, right? Bow legs, rickets. Don't we know that? Bow legs is rickets. So the probable diagnosis is rickets. And you know vitamin D. Vitamin D is a mineralizing hormone of the bone, and when mineralizing hormone is defective, it causes bow legs. Yeah. So this is the question that many of you were reminding me about, right? So 14-month-old child presented with erythematous, scaly and pustular lesions in the perioral region and diarrhea. So the moment you see diarrhea and dermatitis, yeah, diarrhea and dermatitis, you should think of two conditions. What is the first condition? We all know about pellagra caused by B3 deficiency. But it can also be acrodermatitis, perioral or perianal. Right? So acrodermatitis entropathica because there is diarrhea. It's an autosomal recessive condition caused by zinc malabsorption. Okay, so which mineral will be deficient in this case? It is zinc. So it is acrodermatitis enteropathica. Okay, autosomal recessive disorder caused by zinc malabsorption. There is genetic testing that is available. Poor wound healing was clubbed with this. Oh. Okay. So this is another interesting question, right? A person presented with neurological manifestations mimicking upper motor neuron palsy and sensory neuropathy. So do you see that there is both motor and sensory? Yeah, motor option also had iodine. Okay. Yeah. So there is, you see that both motor neuronal deficits are observed and sensory neuronal defects are observed. So this is called a subacute combined degeneration. So there is a person who is presenting with subacute combined degeneration with anemia. Okay, so what is the diagnosis? If you see both these, it is B12 deficiency, right? It is B12 deficiency. So how will you differentiate folate deficiency and B12 deficiency? Folate deficiency will present only with macrocytic anemia. B12 deficiency will present with macrocytic anemia as well as neurological manifestations. Yeah, macrocytic anemia is because which enzyme is dependent on B12? Methionine synthase. Methionine synthase is dependent on B12. So in B12 deficiency, methionine synthase will be inactive. So all tetrahydrofolate will be trapped as methyl tetrahydrofolate. And because of folate deficiency, there is macrocytic anemia. Neurological manifestations is because of the deficiency of methylmalonyl-CoA mutase. A question on facilitated diffusion. If you can recollect the question, I'll be able to help you answer it, Dr. Roshni. I was not told about that question. So methylmalonyl-CoA mutase is also dependent on B12. So in B12 deficiency, when methylmalonyl-CoA mutase is inactive, methylmalonyl-CoA accumulates, that gets incorporated into myelin, and that causes demyelination. That is why neurological manifestations as well. Facilitated diffusion was an image based question. Okay. So what is answer? Was this asked? I was told by only one student that this was asked. Respiratory distress syndrome is caused by the deficiency of surfactant. Which is the major chemical composition of surfactant? It is dipalmitoyl phosphatidylcholine. And what is phosphatidylcholine? It is lecithin. So what is the right answer? It is lecithin. Even day before yesterday, the evening session, we had this discussion. Lecithin deficiency causes respiratory distress. Okay. Yeah. A chronic alcoholic has high NADH-NAD ratio. We know this, right? A chronic alcoholic, when alcohol is metabolized by alcohol dehydrogenase and aldehyde dehydrogenase, in the presence of both these dehydrogenases, NADH level will be elevated. And when NADH level is elevated, what are the effects that you observe? All pyruvate will get converted to lactate. So will you observe low lactate level? No. What are you going to observe? Observe high lactate. And they are more prone to develop hypoglycemia. Phosphatidyl ethanolamine instead of kefalin. Okay. Got it. And then diphosphatidylglycerol glycerol was there? This question was not there. I was told it was asked. So which of the following is expected in this individual? That is high urate. Option was NADH, NAD will be low. No. We know that in chronic alcoholism, there is a very high NADH-NAD ratio because every time alcohol gets metabolized by alcohol dehydrogenase followed by aldehyde dehydrogenase, every time NADH gets generated. So I've told you about this so many times. In chronic alcoholism, there is a very high NADH-NAD ratio. And that is why pyruvate gets converted to lactate, so there is high lactate. And because there is no pyruvate, there will be low glucose. And they are prone for hyperuricemia. They are prone for hyperuricemia for two reasons. One is alcohol increases uric acid synthesis. Second is alcohol interferes with uric acid secretion in the renal tubules. Okay, that is why they are prone to develop hyperuricemia. high urea. High urate is the right answer, Monica. Yeah, if that helps you. So what will you see? You will see high NADH-NAD ratio, choice A. Choice B, that will be high lactate. Choice C, high urate. High urate, urea level, there is no reason for urea level to be affected until the person presents with chronic kidney disease. Okay. What is answer? A child's urine, okay, high urate and high lactate was given, then that would be the best option, Samant. Thanks for giving me that option. So for this it is high urate and high lactate. Both are features of chronic alcoholism. Chronic alcoholic with gouty arthritis, and they asked us to choose the correct statement. Okay. In that case, the answer would be high urate and high lactate. Okay. So what is the right answer? Very simple question, right? Urine turning dark on standing. It is alkaptonuria, because alkapton means black. Alkaptonuria is black urine disease caused by the defect of homogentisate oxidase. Congenital erythropoietic porphyria. Another option was alkaline phosphatase will increase in alcoholism. So in alcoholism, you know, AST will be double. You know that, right? No, ALT. Yeah, there will be a change in ALT-AST ratio. Alkaline phosphatase, no point in that enzyme getting affected. GGT will be elevated. In alcoholism, the early marker would be GGT, which gets elevated. It is not alkaline phosphatase. Childhood black urine syndrome. Okay, that is alkaptonuria. Okay, so these are the 16 MCQs which I got. If you have any other MCQ which I have missed, you can please message that to me. I will give you the right answer. Okay, I hope this session helped. Tell me, Ruhi, I'm here to listen. What is that you want to say? I didn't see any of your messages before. Maple syrup urine disease. Okay. A low NADH-NAD ratio is not true. Increased alkaline phosphatase is not true. High urea and lactate. Increased urea and urate. High urea. Then I would go with high urea and urate. I don't see anything else to be appropriate. Yeah. Phenylketonuria. Okay. Maple syrup urine disease, we don't see black urine, Ruhi. At least in phenylketonuria, sometimes you get to see black urine, but definitely not in maple syrup urine disease. High urate and lactate would be the best answer. Okay? Yeah. Yes, zinc deficiency can cause poor wound healing. Thanks, Roshni. Vitamin K dependent clotting factors. Okay. Okay. I was not told about this. It is 2, 7, 9, 10. Factor 2, 7, 9, 10, protein C, protein S. My one-liner helped. Thank you. Yes. So thank you all. See you again with another YouTube session. Yeah. And please don't forget to subscribe for PrepLadder recorded video version, because we have come up with a new session, new series of recorded videos which is appropriate for NEET as well as next. Because all educators, all of us have ensured that we have all integrated case-based MCQs, image-based MCQs. So it will be completely clinically oriented. It will be very appropriate for you to get ready for both NEET as well as next. Okay, so do not forget to subscribe. Thank you.